Hello and welcome back to Ahead of the Curve. I'm excited to have you with us today. In today's episode, we're diving into the unique approach to scoliosis care known as the Schroth Method. And it's something that's talked about a lot when we're discussing kind of the cutting edge of scoliosis care. But a lot of times it's hard to find a practitioner or get support from your doctor in kind of getting you into a treatment plan that involves the Schroth method. So we're going to explore how it differs from traditional methods, its key components, and a little bit of the research that supports the effectiveness. So before we get started in all of that, I just want to do a little bit of an update. This past week is, when I'm recording this, today is June 2nd, and the month of June is Scoliosis Awareness Month. So this whole month I have been, and I anticipate and I plan to be doing free classes for people that have scoliosis. So it's my Scolio Savvy fitness classes once a week. Probably by the time that this episode is out, they will no longer be free, and it is a monthly fee associated with those classes. We're meeting once a week on Wednesdays at 10 a.m. for the live classes. And then if you can't make the class live, you'll get a recording sent to you later, and then you'll have access to all those recordings for your lifetime. So they're really excellent ways to get in some exercise and movement that is safe for scoliosis. So you can exercise without the fear of getting injured, and really begin to build out a little bit of a plan for yourself so that you're not kind of twiddling your thumbs when you go to the gym. We'll be doing Pilates exercises. Some weeks will be strength training. Other weeks will be bar classes. And I'm also toying around with doing some dance classes as well. So I want to make it fun because not a lot that has to do with scoliosis is very fun in general. So I believe that the more that we can bring joy into the way that we're moving and kind of our lens of our life, I think the less pain that we're going to have, and the more likely you are that you're going to actually do the exercises. So this is not for specific guidance or coaching on your curve type. This is more generalized exercise that is safe for scoliosis and spinal fusion as well. For more catered work, you can join my collective small group coaching program, my Scoliosis Strength Collective, which I've talked about plenty on this, and all of that will be linked in the show notes. And then also we had our monthly Q&A this past week. Caitlin Carlson joined us, and she is someone that has scoliosis. She is a counselor. She is a massage therapist, a yoga instructor. She wore a brace for her scoliosis for 6 years of her life. So she has a very personal experience with scoliosis and its effects on your development in adolescent, and then carrying that over into adulthood. So she joined us in the collective, and we talked about all things that have to do with our emotions and how they are so tightly intertwined to our scoliosis and our ability to live a pain-free life or live with chronic pain. So our emotions are very deeply connected to pain. I think that is it for my updates. So before we delve into the specifics on the Schroth method, I think it's important to first understand the traditional approaches to scoliosis care. And if you're somebody who lives with scoliosis, or you love someone who lives with scoliosis, you're probably very familiar with the traditional approaches, which include observation, traditional physical therapy, bracing, and surgery. So often with the mild cases where the progression of the curve is monitored over time, that's kind of the bucket that the majority of clients that I now work with have fallen into. They were monitored for a period of time, and once they hit 18 and their curve was still in the mild range, they were just basically set free and really no longer observed or monitored after that point, because the understanding at that time was, and kind of still with traditional medicine, is that the curve cannot progress after that point, which we know isn't true. I have plenty of clients who, after they've been released, their curve has gotten worse after pregnancy, after menopause, and just life. So then the second thing is bracing. So bracing is obviously, that's where you wear a specialized brace, your curve is assessed, and the brace is propped in certain positions to bring your spine into more of a neutral position so that the spine is stacked on top of itself. And they're created to slow down or prevent further progression of the curve. And this is especially important for people that are going through periods of rapid growth. So usually in adolescence, or even during puberty, that's the traditional route for somebody that has more of a moderate curve. And then usually at that point, when somebody is braced, they're also recommended to participate in traditional physical therapy. Now, there are doctors out there who are a bit more progressive, and they have connections to scoliosis, physical therapists who specialize in scoliosis and are trained in the Schroth Method or Pilates for scoliosis or the Leon Method. However, that is still fairly rare that happens in the United States and around the world. So when you go to traditional physical therapy for your scoliosis, they are just going to be treating your symptoms. They're not going to be treating your actual scoliosis, because they don't have the tools and the information to do that. It's not something that's taught in physical therapy school. In physical therapy school, we are taught how to modulate pain, and we are taught to treat your scoliosis as though the pain that you have from your scoliosis, as though you have a spine without scoliosis. So we are treating that spine, like anybody else that has lower back pain, middle back pain, neck pain, instead of really understanding the curve that you have and how to make adjustments and modify for that. And we'll get into that a little bit more in a couple of minutes. And then in the severe cases, surgery is necessary generally in order to straighten and stabilize that individual spine, and to really prevent disability and functional limitations later in life. So if you are someone who has a curve over 30 degrees and you don't do anything to help your curve, you don't do exercises for it, you don't brace, you don't do surgery, on average, your curve will progress about 1 degree per year, year over year as you age. So that's why sometimes surgery is a necessity, and people are able to have that surgery successfully and live a very full, vibrant life. So there's lots of inspiring people out there who have gone through spinal fusion, and they live a very active lifestyle. So just actually search high-level athletes or Olympic athletes who have had spinal fusion, and you'll be really surprised that there's a lot out there. So while these traditional methods have their value, they have their merits, they are primarily focused on managing symptoms rather than addressing the underlying cause of the scoliosis. So now comes in the Schroth method. So the Schroth method, it takes a non-invasive exercise-based approach to scoliosis care. So those are some very fancy, large words. So it's non-invasive, meaning we're not doing injections, we're not doing surgery, we're not bracing. Sometimes bracing is in conjunction with the Schroth method, but it's non-invasive. So it's all exercise-based, and it is specific to your curve. And it was developed by Katharina Schroth in Germany in the 1920s. So over the years, the method has evolved. You know, we have the Barcelona school. We now have SSOL, which I've gone through. So that's the training that is led by Higit, and there are several other schools that have branched off of the original Schroth method, and there's little teeny variations in them, but overall they all follow the same methodology. So with the Schroth method, the aim is to address the three-dimensional nature of your scoliosis by focusing on postural alignment, spinal elongation, and muscular activation. So its goal is to improve your posture and then your overall function. So with scoliosis, during development, there is a wedge deformity that ends up happening in the vertebrae. So your vertebrae become wedged, and instead of, this is not really a good visual, but here we are. So instead of your vertebrae being the same width and diameter the whole way around, one side becomes lengthened and the other side is a little bit shortened. And it turns into this vicious cycle. So on the side that is lengthened, it's actually, there's a traction that happens, there's a pulling and tension that happens on the bone that causes the bone to grow more rapidly. And then on the side that's smaller and more compressed, that compression causes the bone to grow more slowly. So the vicious cycle is occurring. The goal of the Schroth method and scoliosis specific exercise is to jump in at that point in order to break that vicious cycle. So the goal is to more evenly load the spine, more evenly load the vertebrae, and you are doing that through specific exercise and through activity modification throughout the day. So there's several key components within the Schroth method that it involves various exercises that are tailored to each patient's scoliosis specific curve. So the exercises, they all include breathing techniques, postural corrections, and scoliosis specific exercises. Now, the breathing exercises, I've talked several times about breathing. If you've been listening to this podcast for a while, I believe actually episode 3, I really delve into all things breathing. And I talk specifically about whether you're breathing in a way that is countering your curve or actually promoting your curve. So you can refer back to that episode that will be linked in the show notes. But the breathing exercises, they aim to improve your rib cage mobility and help to create a more balanced 3-dimensional expansion of the chest. So the postural corrections, they focus on aligning the body first and elongating the spine. And then once you're in that more elongated position, you are trying to achieve the most expansive breath possible in order to change the shape of the rib cage. And I love looking back at the yellow book. I believe it's the three-dimensional approach to scoliosis care, and that's available to anybody. It's written by Katharina Schroth, and it has these photos in there of people who have trained with her, and they've gone through, they've gone from having very, very severely compressed rib cages, and you can see the rib cage actually change shape. And it's not just young adolescent people who are achieving these changes in their rib cage shape. It's adults. It's people that have, their scoliosis, they've stopped growing for years. They may be in their 30s or 40s. And I mean, possibly even later in life, some of them. And you can see the amazing changes that they're able to make through the specific breathing techniques. And, you think about breathing and you're like, this is just something that happens very automatically. I don't even think about it throughout the day. But when you are able to bring your attention to your breath and stack your spine in your corrected position, and then you try and really breathe and expand into those hollow spaces, it's amazing what you're able to achieve and what you're able to do. And, I've been able to do that for a lot of my clients that I work with. And it's really neat to see that take place. So in addition, there's also scoliosis specific exercises that target specific muscle groups to help stabilize and strengthen the weaker areas while promoting some flexibility and length and balance in other areas. So active self-correction techniques and proprioceptive awareness, they play really vital roles in empowering these clients and these patients to maintain proper alignment throughout their daily activities. And I really, truly believe that I think exercise is tremendously important. I think the specific exercises definitely also play a role. However, I also have seen people really take ownership of their active corrections and integrate that into their life. And that's been, their main focus. And they've been able to really achieve a lot of change in their body. So I don't think that there's just one way to tackle scoliosis. I think that there's a multitude of ways that you can approach scoliosis care, but I do think it needs to be specific to the individual and to their curve. So now that we've kind of talked about how the Schroth method started, how, what are the pillars of the Schroth method, let's just explore a little bit about the research and the evidence supporting the Schroth method. There's recent studies that have demonstrated positive outcomes for individuals utilizing the Schroth method. So researchers have found improvements in Cobb angles. So Cobb angle, that's the degree of your spinal curve. And that just shows that they're reducing, excuse me. They've found an improvement in the Cobb angle. So that can mean two things. That means that the Cobb angle is actually shrinking and getting smaller. And that also means that they are stabilizing that Cobb angle and it's not getting worse, which is kind of the natural progression of scoliosis. If you don't do anything about it, it will generally continue to curve and increase. Other studies have shown reduced pain levels and functional improvements in daily activities for people who have gone through the Schroth method. There's specific research papers and publications that support kind of what I was just talking about. So the studies, they'll be linked in the show notes, and I'm going to hopefully not totally destroy these lovely people's names that created these studies. So there's Weiss, Kuru, and Matacone, and they did a paper that has a lot of wonderful evidence to support scoliosis specific exercise, specifically the Schroth method. So I highly recommend checking those out if it's piqued your curiosity, so that you can kind of have a deeper understanding of the research behind the method. So, I think I kind of go back and forth. So I think that research is incredibly important in showing proof that things work, that methods work. I do think that I see a lot of clinicians, specifically physical therapists, they often kind of go into this mindset that if there isn't high level specific evidence for these treatments, that they're not going to use them. And they completely disregard clinical evidence. So clinical evidence is what you see happening in your patients that you work with every day, or your clients that you work with every day. If you are a physical therapist or any form of movement practitioner, so Pilates instructor, chiropractors, you begin to notice trends in the people that you work with. And trends meaning, patterns that happen through lifestyle choices or effects of treatments that you're introducing to them. And that's what clinical evidence is. And it's not specific, it's not the gold standard, but I do believe that there's a ton of value in that. And clinical evidence for myself is what I see happening in my own body as somebody that lives with scoliosis. I see what it has a positive effect on myself, and the way that my back is feeling and my curve rotation and progression or reduction in that. So I think that, yes, research is important, but I think that clinical experience and clinical evidence is, almost as important as well. So integrating the Schroth method into traditional scoliosis care, it can provide additional benefits for people with scoliosis. It can complement some of the traditional methods, or it could even replace them. So if you're an adolescent, or if you're a person that is beyond adolescence and bracing isn't an option for you, or you don't want to choose to do bracing, I think that this is a really wonderful alternative to that. And the same thing with surgery. Not everybody is a candidate for surgery, even if you do have a severe curve. If you suffer from osteoporosis, you are not a candidate for surgery. It won't hold in your bones. And the Schroth method and scoliosis specific care can be a wonderful alternative for you. So it's really important that the Schroth method requires an individualized treatment plan and guidance from trained practitioners. So you can find a certified Schroth method provider through a couple of different avenues. You can visit the official website of the Schroth Barcelona Institute, or you can also visit the SSOL website. I will link both of those below in the show notes, and you can find professionals there that have special training in the method. So I'm really glad that you tuned into this episode to learn more about the Schroth method. This is just a little bit of an introduction to it. I didn't even get into kind of the nitty-gritty with the tools and things. I just wanted to kind of give you a taste of what it's all about, how it was created, a little bit of the research. I will be doing another episode that's more geared towards what props you need, kind of how long it takes in order for you to see changes in your body generally, and kind of the amount of daily exercises that you need to commit to in order to see those changes. So I'm really glad that you tuned in to another episode of Ahead of the Curve. Until next time, stay tuned and stay ahead of the curve.